Hello, everyone, and welcome to Clinically Speaking, the Ivy podcast where we bring you real conversations with rehab professionals about what it takes to deliver outstanding patient care. I'm Bismarie Placencia, our social media manager and host, and today we're diving into a topic that's very close to our hearts: the powerful partnership between physical therapists and physical therapy assistants. This episode, the PT/PTA Dream Team, shines a spotlight on how collaboration, communication, and mutual respect between PTs and PTAs create better outcomes for patients and stronger, more fulfilling careers for clinicians. I am very excited to be joined by some of Ivy's best, these amazing guests who bring a wealth of experience and passion to this conversation. I want to introduce Alyssa Thrush, who is Ivy Rehab's Vice President of Clinical Excellence. She actually started her career as a PTA and is now a board certified geriatric specialist. Next, I want to introduce our own PT/PTA Dream Team, Alyssa Amereno and Matthew Kester. Matthew is a clinic director at Ivy Rehab's Hackettstown, New Jersey location, and a PTA and licensed athletic trainer with a background in sports and functional training. Alyssa Amereno is a licensed PT and certified lymphedema therapist who recently completed Ivy's Oncology Rehab Residency and is dedicated to improving cancer rehab care. And lastly, we have Becky Thompson, who's Ivy's Senior Director of Talent Acquisition, who focuses on building and retaining strong collaborative rehab teams. Welcome, everybody. We are so happy and excited to have you all. So, we're going to talk about the unique strengths each role brings, how PTs and PTAs work together day to day, the challenges that they face, and what it really takes to build and maintain a dream team in physical therapy. So, whether you're a PT, a PTA, student, or a leader looking to improve your team dynamic, this episode is for you. So, let's go ahead and get started. So, I want to start with Alyssa Thrush, as she has a background and a passion for PTA specifically. So, Alyssa, I really want to know, why do you have such a passion for PTA and PTAs?
Well, as you mentioned, I started out my career as a physical therapist assistant. Loved being a physical therapist assistant and working with my supervising PTs. And eventually, after doing that for about 6 years, I decided to go back to school and get my doctorate in physical therapy and become a physical therapist. And so during that time, I've had the opportunity to kind of be in both roles in that supervisory relationship. And I think the best piece of that is just the collaboration, the partnership, and the communication that comes with having a partner in crime to kind of vet ideas, discuss challenging patients, talk about overcoming barriers, ultimately to make sure that the patients are getting the best care, and we're really working on focusing on getting some really great outcomes. So through those experiences in life, I see the benefit of that partnership and see how successful it can be, how successful it can be.
When you were a PTA, was there anything that stood out that you still remember to this day that you picked up from your mentor or PT at the time?
Yeah, I think, like I was a new grad PTA going into an outpatient clinic, and I had the opportunity to be supervised by 3 PTs. And I think like each PT that I worked with had a different skill set. And so through that partnership and working with patients and different diagnoses, they all brought a different level of mentorship and just kind of communication and collaboration. So for example, I worked with a PT who was a sports expert. And so she saw a lot of the sports rehab patients. And so through that process, I learned all about ACL repairs, and I learned a lot around just protocols and really getting that patient back to that sports level, which is a little bit different than another PT that I worked with who saw a lot of more geriatric or aging adults. And her primary focus was around things such as managing patients that have diabetes, falls, sensory issues related to neuropathy. And so that just is a whole different level of patient. And so you got all of those different experiences working with those experts.
That's amazing. So that was a really unique experience you had getting to work with these PTs in different fields and expertise.
Yeah. I mean, I think, like ultimately as a PT and a PTA, it's all about learning and just trying to become the best therapist that you can become. And so by having those opportunities in that relationship, again, it just helped me build my skills and also kind of help build that desire to go back to school and become a PT. And that's kind of what brought me here today. So a really cool experience.
That's amazing. Thank you for sharing.
Yeah.
And if you could tell a PT and a PTA one piece of advice, what would it be?
I think everything just comes down to communication, number one. So I think every person is different. Every way that we communicate is different, and every patient is different. And so you might have a patient in front of you who maybe you need to have more touch points between the PT and the PTA because they're a little bit more complex, or maybe they're not progressing as well as you want to, versus maybe another patient, you might not need to have as many touch points. And then I think also that supervisory relationship is really dependent upon, your comfort level and your skill set as well. And so you want to make sure that you're communicating in an effective manner so that you feel comfortable in treating that patient. And so if that means you need to communicate more or less, or you feel like you need more autonomy and you're doing a great job, then it's okay to adjust that, because I think that relationship is really dependent upon a lot of different factors. The other thing I just wanted to mention just really quickly, which I think is important as we talk about the PT and PTA relationship, is that for us as clinicians, I think the biggest thing is that we need to make sure that we know our state practice acts, we know our regulatory rules and regulations, as well as payer rules, because some of that level of supervision, the type of supervision, how often it occurs, is really dependent upon some of those regulations. So, for example, I'm a PT in Kansas, and so in Kansas, I can only supervise 4 PTAs. And if I want to supervise more, I have to get special permission from the board. And also, in addition to that, I have to notify the board of the PTAs that I'm supervising. Another example of kind of following rules and regulations is for Medicare patients. When you're treating them, you have to do a progress note every 10th visit, and that does require the supervising PT or OT to treat that patient for at least one billable unit. And so we just want to make sure that we're following those rules and regulations to make sure, again, we're just compliant and we're really doing what is best for the patient. So there's lots of little things that help kind of influence some of that supervisory relationship as well.
Okay, and you mentioned that each state has its own rules and regulations, correct?
Yes. Yep. So whether you're a PT or an OT or a PTA or an OTA, those state practice acts have specific rules around, again, the amount of supervision, the type of supervision, even documentation requirements. So sometimes you're required to document certain things related to supervision in your documentation.
So if you're a PTA in Florida, for example, but you're making the move to North Carolina, would you have to take certifications, or would it depend on the state and what they require, or you're able to move and continue practicing? How would that look?
So every state is different in regards to practice acts. So if you are in Florida and you move to North Carolina, you need to get a North Carolina PT, OT, PTA, OTA license. And then in applying for that license, again, it's kind of your professional responsibility to make sure that you know that practice act and the rules, because again, what happens in North Carolina might be different than what happens in Florida.
Okay, great. No, thank you for elaborating.
Yeah.
And then shifting over to our PT/PTA dream team that we have here, Matthew and Alyssa, I would love if you guys can share a little bit more on your relationship, how you met, and kind of how many years you've been working and collaborating together.
Um, I'll start. So we have been working together for almost 3 years. Matt was the assistant clinic director when I started at Ivy. And I was less than a year out of school, so he actually took on the role of mentoring me, which started like fostering our relationship. And at first, like, I was like a little nervous about, like, okay, well, it's a PTA that's mentoring me, but I'm the PT. So what can I ask him versus what can I ask him? And honestly, it was all very, like, he had a lot more experience than I did. so in my head, it was almost just like an internal conflict that was never an external conflict. In that, we just discussed, through different types of treatment and different types of patients and stuff like that. And we still do that. But that's kind of how our relationship started and just kind of continued on from there. Like now Matt's the clinic director and I'm the assistant clinic director. So we kind of still have a very similar relationship in terms of like kind of mentor-mentee from 3 years ago when I first started here.
Oh, that's great. Thank you for sharing. And does that background of you coming in as a mentor or as a mentee kind of bleed into how you guys work together today as clinic director and assistant clinic director?
For sure. I think like we both have a lot of trust in each other, and not that we don't in other clinicians that we work with. But I definitely find myself going to Matt with a lot of questions. He comes to me probably more than I do anyone else. So I think that definitely fostered a good relationship.
Great. And then Matt, from your perspective, when Alyssa came in as a PT and you were the PTA, how was that dynamic from your point of view?
From the very beginning, I think our relationship kind of kicked off well. Our clinic was in a kind of a state of flux. Our director, who had been there for literally since it started, was stepping down, and I was stepping up into his role. And Alyssa came in as a relatively young new grad PT, but we had a great relationship. We got along very well. Like she had mentioned, I kind of mentored her. I do a lot of manual therapy techniques. I have a fair amount of experience. And so I was able to just kind of help guide her through, some of the tougher patients and tougher situations. And then she was always very supportive of me with, running by her things I had in mind, it's appropriate for this patient or for that patient, especially for knowing your limitations and trusting other people when you feel like you're running up against your limitations. As you had mentioned in the introduction, I have a strong athletic background. And so sometimes with, more, older patients, more fragile patients, I'm not sure, is this okay to do? So, it's been great being able to bounce all that off of her and just kind of know that, she's kind of keeping me in line and making sure I'm not, treating people like the athlete they were 50 years ago and not the person they are today. And so I'm very appreciative of, all that she brings to the table and brings to the clinic. So, yeah.
I just want to call out and say, I think, Alyssa and Matt's relationship is a little bit unique in the fact that, again, like he's the assistant and she's the PT, but he's the clinic director and she's the assistant clinical director. And Matt is more experienced, and Alyssa came in as a newer or less experienced clinician. And so despite all of that, titles don't mean anything. It's all about, again, that communication, that partnership, collaborating, just really working together for the patient. And so I think they're a really great example of like, can be some dynamics related to the relationship, but ultimately the goal is to have a very positive relationship, work through some of those challenges. And again, the benefit is to the patient. So kudos to both of you for really maneuvering a really unique situation.
Thank you.
Well, that was very nice, Alyssa. I agree. I was listening to them, and you can tell that they love what they do, and they do have that really unique dynamic, even just by what they're saying. And I'm really enjoying the conversation. So I want to know more. Like, are there any methods of communication that you both use unique to you, since you've worked together for several years and have held several different positions? It'd be great to hear how you guys communicate with each other.
It's very like face-to-face communication is very easy for us. Within the clinic, we share an office as CD and assistant CD. So we literally spend, if we're not hands-on with the patient, we're sitting next to each other all day. And so it makes it very easy to just, oh, hey, by the way, what do you think about this? Or what do you think about that? Or, hey, when you saw this person last, how did they do? Because we're always right next to each other. Otherwise, I feel like email works really well. We do, if we're going away on vacation, not just Alyssa and I, but most of the clinicians. We have a big clinic. With OTs, there's 12 of us, 12 clinicians. So, if people are going on vacation, we'll shoot out emails to whoever will be picking up our patients so they know what we've been doing and what to expect and what we've been working on. So I would say usually email and face-to-face is what works best for us.
Yeah, I agree with that. I think I'm very much a little bit of a control freak, and like to look at the schedule ahead of time and see what's coming and see who's treating who. And I try to get ahead of it. And like Matt said, I'll email the clinician if I'm not going to see them, or I will talk to them face to face. And I think for me, as a PT, a lot of my patients, when I do go on vacation, will fall to, we have Matt as one of our PTAs, and then we have one other PTA. And I think a lot of my patients will then fall to them because other clinicians have the evals and their own caseload and stuff. So I just try to be really open with them to provide the best treatment to the patient. But yeah, I usually, if I can speak face-to-face, I do, otherwise email.
Yeah, if I can just follow up on that. So Alyssa and I were at an event last week, and we were commenting on how we really complement each other well. Her strengths are my weaknesses, and I feel like my strengths are her weaknesses. And
I love that.
She's amazing. She's like, next week on Thursday we have this issue, and I'm like, I show up on Wednesday morning. All right, what's going on today? When did we see the schedule? I don't look ahead at all. And they're like, all right, we got it. We got to fix that. We got to take care of that. Thank you. She is much better than I am at looking ahead and heading off problems, and then whether it's sending a message through Teams to our patient coordinators, whether it's an email to the clinicians, making sure that the clinic as a whole is kind of running smoothly. Yeah.
It's nice to hear your balance. And then I just want to make a comment, because Alyssa said she was a control freak, and I say I don't call that being a control freak. I feel that that's just passion and caring about your patients. Don't call yourself a control freak. So.
Oh, no, these are great points, and I'm really enjoying it because you can tell you guys work great together. And I did want to ask, are there any fun moments that you can remember, some memorable times together, either collaborating on a patient project or even just moments in the clinic, as assistant clinic director and clinic director? Anything come to mind?
I don't know. Unless anything jump out. I try to keep the clinic fairly lighthearted. I think that people coming in, if they're coming to PT, they're not in their best spot in their life, right? Nobody really wants to be having to go to PT. So I think we have a really good crew overall. Like I said, we have 12 clinicians, and then with aides and front desk, we have over 20 people on staff. And just making sure that, people have smiles on their faces. All right, patients come in and they're in pain, they're hurting. But we're going to be positive all the time. We're not going to project negativity to people who are already struggling. And so we try to keep it fun. We have some characters in the clinic, and then we're always kind of teasing each other and laughing and just trying to keep everything fun overall. So I don't know if I can think of any particular standout moments, Alyssa. I don't know.
Yeah, I don't know if I can either, but I think just to echo that and kind of what we talked about earlier, Matt said, there's over 20 employees. So there's a lot of faces in the clinic. And ultimately, we really don't, we use the titles to what they're meant to be, but we all work together very well between the aides, the front desk, and, PTs, PTAs, the OTs. Everyone's always communicating and talking, and it really doesn't matter what your title is. It's kind of all an equal effort to, do what's best for the clinic and for the patients. So yeah, I don't know if there's any particular moments that I can think about. I think we've done a couple of events and stuff that we've gone to just as assistant clinic director and clinic director. But otherwise, I think that it's kind of just an overall the environment.
No, that's great to hear. Oh, sorry. Go ahead, Becky.
No, that's okay. I was just going to say, from a recruitment and talent acquisition perspective, this is what we love to hear, because a lot of our, not just our new grads, but just our, possible teammates, they're asking, what is the clinic like? And they don't mean, I mean, they may wonder what type of equipment and what does it look like and so on and so forth. But the culture piece and everything that Alyssa and Matthew just said, that is so important. And that's what they're looking for. They are looking for a place where they can be a great teammate to the entire group, whether it's 5 to 20 individuals in a clinic, and, really just using that energy to take care of their patients and also partnering with their patients' caregivers. So Alyssa and Matt, I just wanted to say I love hearing this. And it tends to be a theme as we're, talking to our teammates across Ivy.
Yeah, I remember asking that question on my interview, actually, about like the environment when I found out like what clinic I was going to be going to. I was like, okay, like what's the environment like? What are the clinicians like? Like, how much experience do they have? I asked.
Yeah. What kind of partnership, mentorship, and we'll get into all that, I'm sure. But I really just wanted to shout that out because it's just so amazing to hear. And that is a question that we literally get on a daily basis. So.
Cool. Thank you.
I love to see the synergy between you both, but it also sounds like it stretches throughout the clinic. So that's amazing. It's great that you've been able to create such a rewarding workplace, so I feel like that's very unique. You don't find that often, but that's why Ivy is amazing. So, so can you guys give me some in-clinic examples on how you'll typically collaborate on a specific patient, for example?
So we have a couple of patients that, we've obviously shared throughout the years. There was one in particular where Matt's background in like the continuing education courses that he's taken is better off with like people with like hypermobility syndrome. So I was treating a patient. I had treated her for multiple different episodes of different injuries and stuff. And eventually she got this hypermobility diagnosis, and I started treating her. And I said to her, honestly, I think I really want you to see Matt. I think that the knowledge he has for some of this stuff, as much as he can tell me what he would do, I think you'd be better off with him. And so at first she was kind of going back and forth. I think she's been mainly on him now, but after I talked to her and she was like on board with that, because some people are very like one clinician and that's it and don't want to stray from that. So she was on board with it. And I talked to Matt and I said, hey, this is what's going on with her. I think this is what she would benefit from. Can you check this out? Can you see how this would go? And obviously it's been a very successful treatment with this patient. And I check in with him every now and then because I did treat her for a long time. So, I like to keep up with my patients and see how they're doing. So I think that was a good example on how like I used Matt's skill set to, for what's best for the patient, and knew kind of where, okay, that's kind of outside of my line. Not that I couldn't treat her, but he can treat her better. And just we kind of continue to discuss what's going to be good and what's not going to be good for her.
And then just another example, especially now that Alyssa has the oncology residency completed. I know that I have learned a ton just secondhand from things that I've heard her mention and overheard her talking to patients. So it's almost to the point now where if I'm treating somebody and they mention they have, even if it's not one of Alyssa's Alyssa didn't do the IE, someone else did. And I know that they mentioned they have a history of cancer. I'm like, all right, Alyssa, hold on. I'm like, wait, hold on, Alyssa, come here. Like, is there anything I need to know? Is there anything I need to do differently? Is there anything that I shouldn't be doing with this person in lieu of that? Because things that before she started that, I just would have assumed I'm going to continue to treat this the same way I would for anybody else. Now I know that I can't think that and assume that anymore. And so yeah, there's a lot of questions on what is still appropriate. So she's been great about sharing that knowledge, not just with me but with everybody. Making sure that because lots of people have cancer history. People come in for all kinds of orthopedic issues, but they have a cancer history, and depending on how recently that was, depending on whether they had chemo or radiation or a combination, that can affect what is more or less appropriate to do. And 2.5 years ago, before she started that residency, we didn't really take that into account at all. And now we're much better about making sure that what we're doing is the right thing. So, yeah.
I know that's incredible that you can both support each other in that way, because that's what makes the perfect partnership, I feel. I mean, how confident you are that, I'm going to pass this patient on to Matt, or I'm going to pass this patient on to Alyssa, because you know each other so well in your backgrounds and your specialties. So that's fantastic. And Alyssa Thrush, I see you smiling and loving everything they're saying. So I wanted to ask you, do you want to add anything?
No, I just love it. And I think it's all about, again, like you're using your strengths and your weaknesses to benefit the patient. And so again, it's just selflessness to benefit the patient. And then I will also say, like, kudos, because comorbidities are a thing, right? Like, no matter what we have in front of us from a diagnosis, all those other comorbidities really can impact our plans of care. And so the fact that you guys are recognizing that and embracing that, and you have Alyssa's expertise to lean on in that process is amazing. So again, just a really great example of good clinical care and great partnership there. So it just makes my heart happy, and it reminds me of why I became a PT and a PTA. So thank you.
Thank you. And I did want to ask, because both you, Melissa Matthew and Alyssa, you've both kind of grown within Ivy, and especially you, Alyssa, where you've gone, you came in as a PT, now you're assistant clinic director, and you also finished the residency program. I wanted to ask for both of you, like, your perspectives on your growth at Ivy. And, I know Becky will jump in and potentially talk a little bit about that as well, but I'd love to hear your perspective and how that process was for you both.
I initially, when I started as a PT, I had worked as an aide at 4 or 5 different clinics throughout since I was 16. So I had a lot of experience just in different types of outpatient orthopedic clinics. Number one, I never thought I was going to go into outpatient orthopedics. Number two, I never thought I was going to work at a big company. I then worked at a small company, kind of saw not the ugly side of it, the side I didn't particularly want to do. And that kind of opened my eyes to, I want a lot more opportunity to expand who I'm working with, what I'm doing. And like, I always knew I wanted to go into like a leadership role. Like in high school, as the captain of my field hockey team, like that was always kind of a direction for me. So a big reason I came to Ivy was for the growth potential that I could have. I had no intention of doing a residency when I started at Ivy. Which obviously it pretty quickly changed, because I'm pretty sure I decided to do it less than a year after I started. And it was honestly a patient that inspired me to do it. I felt like I could have helped her better. She had like end-stage cancer, and I feel like I feel like none of us could do her justice. And I felt like there was so much more I needed to know. This oncology rehab residency came up, and I was like, I think that's the direction I want to go. Again, I never thought I was going to do like straight or outpatient orthopedics. So I did a little bit of pediatrics also. While I was working here, I had a second job as well. So I kind of shifted from that into the oncology stuff, and I haven't really looked back, but that's kind of why I joined Ivy, was for the growth. And I'm I'm happy with how it's gone, the direction it's going. And yeah, I'll let Matt speak.
Yeah. I kind of will echo everything she said. I started when I was first offered the position at Ivy. I was talking to one of my mentors about it, and he actually cautioned me against it. He said, don't work at Ivy. You're going to hate it. You're not going to like it there. It's a big company. It's not for you. You're not going to like it. And I almost didn't take it. I almost declined the offer. But accepting the offer was without a doubt the best career decision that I've ever made. And I'm not just saying, everybody thinks you just say that when you say things like that. But Ivy has been great to me, has been very fair to me. I never had any interest in any leadership role at all. That wasn't who I am. I like treating my patients and going home and being with my family. And then there was a assistant clinic director position open. The assistant clinic director moved up to take over the CD at a different clinic. And, the clinic needed some help. Like, hey, Matt, just try it. So I did that. And then I was there for a year. And then our clinic director was an amazing guy. He was the clinic director, and then he was also a part-time athletic trainer at a local high school. And he ended up wanting to swap that. So he was full-time athletic trainer, only part-time. So he couldn't get the clinic director role anymore. So they were like, all right, Matt, just try the clinic director role. Just try that. And so I did. And, 2.5 years later, I'm still here in this position that I never thought I'd be in. And really all of that growth, all of that success, not only professional development, but my personal development in taking on that role, taking on that leadership role, I owe entirely to Ivy. And then the boss, the clinic director who hired me, Brian, the regional director at that time, Brian, and then our current regional director, Nikki, their kind of faith and trust in me in helping me move up and overcome my own doubts and fears has been, very meaningful and significant to me. So I owe them all a huge thank you. So, but Ivy's been great to me.
Oh, that's amazing to hear. I mean, we all had smiles on our faces the whole time because it's beautiful to hear these amazing testimonials from you both. And Matthew, if you were to look at someone that also told you the same thing, like, I don't want to be in a leadership position, what would you tell them?
I would tell them not to rule it out. You don't know. You see some of the negatives of a position, and every CD in the company will tell you that there's negatives to this position. There's no doubt. But that ends up being what you see, and you don't see the personal fulfillment, the personal reward, and the personal growth that comes with it. That when they say that growth never happens inside your comfort zone. And so you have to step out of that comfort zone, and then you start to realize how much you can grow. And I realized I had skills and abilities that 2.5 years ago, I would have said that these were impossible for me. And now it's part of what I look forward to. The marketing side, the reaching out to doctors, the trying to create relationships within the community, that was the stuff that I said, hey, I can't do that. That's not who I am. And now that's honestly my favorite part of the job. I look forward to times when I can go out and schmooze with doctors and go to some community meeting and talk about what we do. So that's now my favorite part of the job. So it's been great.
That's amazing. No, thank you for sharing. And it's great to hear, truly. And Becky, I wanted to give you an opportunity to really shine a light more on Ivy's growth opportunities and just everything we have to offer, because it's truly a lot for our teammates.
Absolutely. And, to Matt's point one, we have so many teammates throughout Ivy that are just happy to have a conversation, to really talk through opportunities or concerns, or, Matt, even to your point, you're like, oh man, that really wasn't for me. And then, you end up talking to some great people in that space, and maybe your thoughts change a little bit, like, okay, maybe I could try this. And then, wow, this really was the best fit for me, not just company wise, but even role wise. So I love to hear that. And yes, growth, throughout Ivy, it's a huge opportunity. And I'm not just speaking from a ladder perspective. I'm also speaking from an educational perspective. Even Alyssa speaking To her point of our residency program, we have multiple of those to offer. We also have one-to-one coaching efforts as people are coming in, either as a new grad or just as a new clinician to Ivy. We are very big in mentorship and partnership. Even, thinking of a buddy system, who can I speak with to really not just learn new techniques from a clinician standpoint, but also, what is Ivy culture like? How can I incorporate that into my day-to-day presence within the clinic and then also with my patients? We also have organizational networks and connections. So we have monthly check-ins for clinicians to talk about certain topics. We do have the opportunity for our experienced therapists to really share their knowledge, education, experience, and lead clinically as well. That can either be in clinic or, virtually as we are going through various topics to discuss maybe something that's new, a new technique, or even a new educational opportunity. And then we also have, when we do have these virtual sessions, we do record those. So for anyone that maybe, couldn't make a session or wasn't able to join a discussion or really just wants to go back throughout the history as they start with Ivy, we do have those available as well. So the growth opportunities educationally are huge. And then also speaking from a ladder perspective, we do have various types of positions here at Ivy, and even leadership positions that doesn't necessarily mean, a clinic director. It can be leaders throughout different areas of Ivy as well. So I know Alyssa mentioned she loved expanding her knowledge from going through the oncology residency. So we also have the expansion laterally as well as, throughout those leadership positions. Last but not least, we do offer the opportunity to become a partner with Ivy through our de novo program and opening a new clinic. So if someone, comes into Ivy either, externally or a teammate internally that is interested, we do have that growth opportunity to actually become a partner with Ivy and open up a new clinic. So we do have a variety of different expansions across the board, both from an educational standpoint as well as a career standpoint.
Thank you for shining a light on that, Becky. And then kind of shifting gears back into the PTA conversation, when we're looking for new PTAs to join the Ivy team, what are some qualities that the recruitment team looks for?
Absolutely. So to really focus on, each state has their own state practice act. So again, just going back to what each state requires, but really looking at those intangibles. We spoke about multiple of those throughout the call already. The strong communication, the partnership, the passion for strong clinical care of our patients, the partnership with our caregivers, someone that is detail oriented. As we're going throughout the day, are we making sure that notes are updated or everything is as it should be, both from our patients as well as from the Ivy side. And I think, the biggest part, which I loved hearing from Alyssa and Matt, was really that partnership piece, knowing when, hey, I may not be the best person in this situation. Let me grab someone. Let me really make sure that this this patient is taken care of and their care is elevated. And knowing when, and that humility piece, and knowing when it's great to say, hey, you know what, I have someone even better for you, and this is why. So really that partnership communication piece, that passion behind that quality of care. And then of course, some technical details that we may look for depending on the opening, but I think across the board, those are really the intangibles that Ivy's look for.
Awesome. Thank you. And then how can we make sure that new grads understand the value of a PT and a PTA and how that collaboration needs to be strong? And Alyssa Amereno, I would love to hear your perspective on this as well, as you entered Ivy as a new grad. So just kind of how can we help new grads really understand that value?
Yeah, absolutely. I mean, I think there's several stages throughout partnering with Ivy. I think one, it can start with our clinical rotation. So as students are even still in school, doing a clinical rotation with Ivy to really gain that day-to-day experience, see how the clinics do run, whether it's a smaller clinic to a larger clinic. We can also, as students are actively graduating, as they're making their decisions on where they want to start, I think even, myself and my talent acquisition team, having the ability to communicate and answer the questions that they are looking to be answered, and then really offering the experience throughout the interview process. So, maybe not even just a formal interview, but let's set you up for a shadow day. Let's have you walk around the clinic that you would be working in to look at the dynamics, see the people that are working there, see the type of patients that come in and out of the clinic on a day-to-day basis. And that way too, the pressure really comes off and they can really see, okay, this is where I'm going to be. These are the people that are the teammates that I'm going to work with. And that way they can really engulf, okay, going through the formal interview, let's have answer those questions and meet those individuals. But, can I picture myself here? And I think that's one of the biggest pieces too, because as much as we're interviewing, clinicians to come in and be an amazing Ivy teammate, vice versa, clinicians are interviewing us as well. Is this the right fit for me? And Matt, you mentioned, as you were coming into Ivy, you got a little, don't do it. Maybe, the big companies aren't the best fit for you, right? And, that way we can really show and provide what life would be, a day in the life scenario. And if it isn't a good fit, that's okay. Maybe they do want something a little smaller or a different setting, but, at least we can provide that insight and that experience so they can make an educated decision.
Yeah, I think all those were a lot of that was important to me. I was actually initially hired for a different clinic. And when I asked that question about the environment and what are the clinicians, Steve Cowley explained it to me. He was, the regional director at the time. He explained those clinicians to me. I think there was 2 new grads that were there, and there was a couple other seasoned clinicians and a PTA. And I was like, that sounds very manageable to me. I feel like I'll fit right in. And because there's new grads, and I'm very much I get afraid to go out of my comfort zone.
You would have your buddy. Yes.
Yeah. So exactly. So then I get a call that from Steve asking me if I would switch clinics, because I lived a little bit closer to Hackettstown, and the other clinician they were hiring lived a little closer to the other clinic. Mm-hmm. And I was like, it doesn't make a difference to me. I was like, oh, but what are these clinicians like? Mm-hmm. And everyone at this clinic, I think there was 3 PTAs at the time, and I don't know how many PTs, but everyone had a lot of experience. And to be honest, I was pretty intimidated by it initially. So, but then I walked in, I never had a problem, obviously. I walked in and, everyone kind of, I was able to ask questions to everyone. Matt mentored me, like I said. So it really is just about communication and being able to communicate. And I was able to communicate, and I think that's a big thing. So yeah, that's kind of how I look at it.
And I think that's huge for you. And thank you for sharing that, because, you may be expected to start somewhere and you are mentally locked in. I'm going to have, new grads by my side. We're going to be a team, work together. And then, we get the call, and the cool thing is, Alyssa, you could have said no. You could have said, hey, I really feel strongly about this clinic, and thank you for being open, several years ago to making that move. But how great is it for you to now look back and say, how cool is it that I had these mentors in place? I came into a clinic surrounded by experience. And then now also, as our discussion has progressed, we've learned that you have also been a mentor, Matt and yourself back and forth, and other clinicians within the center. So I think it's a great story, because again, it kind of just shows I'm not so sure. And then you're diving in, and then you're being able to learn and grow so much. And then flip side to that, becoming that educator on the back end.
Yep. And I do have a new grad mentee right now. So it has been very interesting. He started about two months ago, a little over 2 months ago. So that's been an interesting learning experience for me as well.
Yeah.
It's come full circle.
Oh, yeah.
Yeah.
It's come full circle in other ways as well, because Alyssa might have been intimidated when she first walked in, but right now everyone else is way more intimidated of Alyssa than she is.
The tides of her.
Oh, that's great. And Alyssa, how is it being a mentor now?
It's fun, and it's really nice. I mean, he's another PT, but it's just really nice to collaborate and learn from him. I think there's plenty, as much as, I'm about 4 years out of school. So as much as I'm still like kind of fresh, there's a lot of stuff I have, forgotten the textbook ways to do things. So it's interesting to hear a new perspective on some of this stuff. And even based on his past clinical experiences, coming in with an outside perspective. And it has been fun. Like right now we're going through ways to kind of regulate using a handheld dynamometer for strength testing across our clinic. And that's what the two of us are working on right now. So it's been really fun to kind of collaborate on that.
No, that's amazing. And, he gets to learn from you, you get to learn from him. So that's amazing. Congratulations on everything. Cause I mean, both you and Matt, hearing your stories, it's incredible what you can achieve and what Ivy can help you achieve as well. We're just all about pushing boundaries. So that's great. And Becky, I want to know more on how clinics can potentially, really showcase that PTAs have really valuable roles in the clinics, and not just, when it's in a supportive environment, but also when it comes to recruitment. And maybe Matthew and Alyssa can also shine some light on this as well.
Yeah, no, really great question. We're even looking right now, adding more PTAs to our Ivy family. It's been a big discussion for the past several months. And it's really brought into light the value that PTAs bring into the clinics and that partnership, and really can learn from each other. I think in regards to highlights and how we can really continue to showcase that, because all of that magic happens in the clinic. So how do we get that information out there? So we are working on different ways of showcasing, hey, this is a day in the life. This is what you will be doing. This is what the dynamic looks like. So going through, testimonials and videos, and even offering, like I mentioned before, that day in the life walkthrough. Hey, if you're even interested in learning more, or, if you're curious, let's schedule that wrap up. And so that way you can literally observe and see what that dynamic looks like. But no, our efforts behind, really highlighting the PTA is absolutely amazing. And, this dynamic here with Matthew and Alyssa, it just goes to show it's a live example that we're, blessed to have on our webinar today, and how people can learn from each other and really value that partnership. And I think that's super important to really showcase, because either new grads coming out of school, or, experienced PT or PTAs that are looking for maybe a new opportunity, and maybe they have a great partnership where they are, and it may be the why, like, hey, if you join Ivy's team and become a teammate, this is what you're going to experience, and this is the dynamic that you're going to have. So I do think it's really important to get that out there, and then do that in various ways so the future teammates can actually experience it.
Awesome. Thank you, Becky. And then if someone is interested in applying for a PTA or PT position, can you shine some light on how they can do so?
Absolutely. Well, first and foremost, please do not hesitate to reach out to me directly. I am more than happy to have a conversation with anyone that is interested in either a position at Ivy or just learning more about opportunities with Ivy. I can then also point that individual in the right direction. I have an amazing talent acquisition team, an amazing team of business partners and coordinators that can start the application process. And then also, if you just want to skim, maybe check us out a little bit, please go to our Ivy Rehab website, and there is a careers tab where you can see all of our active postings listed. And then again, any questions around that, you can reach out to myself or my team directly.
Awesome. Thank you, Becky. And we do have 2 questions in the chat, so I'm going to go ahead and pull them up. They are applicable to anybody, so whoever wants to answer, feel free. First one is, do your patients ever inquire if you are a PT or a PTA?
I'll take that first. Not really. Sometimes they'll ask about education and things like that, and then I'll kind of go into nursing a PT and a PTA, and then I'm a PTA and Alyssa's a PT. They rarely bring it up simply because I don't think many of them realize that there's such a difference, or that such a difference exists. I often will, just to try to help people understand, most people know the difference between a physician and a physician assistant. So I usually start with that and say, physical therapy has the same kind of breakdown. And so that was why Alyssa did your initial eval, and then I've been working with you since. But yeah, they rarely bring it up asking, because like I said, I don't think they know to do that.
Yeah, I think that, oh, sorry.
No, go ahead.
I think that the only times we'll get the questions is like if someone's coming, like Matt has a really good relationship with one of the chiropractors in the area. And so patients will call asking for Matt, and someone else has to do, he obviously does not do initial evals, so someone else would have to do them. And that's like the only time we get questions. Sometimes I've had patients in the past like ask the difference if it comes up somehow, like, oh, they're a PTA. They're like, what is that? And I explain it, and no one's ever questioned it, had a problem with it. It's more of just learning.
I was just going to add, I think like a lot of it comes down to the communication with the patient and the handoff. So if Alyssa's doing an evaluation and she's handing that patient off to Matt, like being able to say like, hey, Matt's my partner in crime. He's my secondhand man, like he has some excellent skills and things that would be really beneficial to you. And that Matt and I continue to have conversations about your care. I'll continue to check in as needed, like I'm here as well. And so I think, again, like just making sure that the patient feels comfortable with that, and just knowing like, hey, I'm an expert, but so is the assistant. They're an expert also. And so like that transition should really be seamless, and the care should be seamless as well. And so just like anything, transparency, communication. Of course, we would always want to make sure we identify ourselves as what we are. I'm a PT and Matt's the PTA, like just having that transparency, I think is extremely meaningful. And in general, patients don't care. They just want to get better. And by having that communication, they trust you and they trust the process. And so again, I think just speaking to it is extremely meaningful.
Yeah, if I can just follow up on that, where the people who have expressed the most concern about that to me have been PTA students that I've had. And my answer to them is always that patients don't care what letters you have after your name. Patients, all they want to know is, do you care and can you help them? And if the answer to both of those things are yes, then they will be happy to work with you regardless of what your license or certification or whatever is. So, yeah. And that's what I found.
Yeah. Awesome.
Great points, everyone. Thank you so much. And then our next question is, which I believe Alyssa touched on a little bit, can PTAs ever perform an IE or discharge a patient?
You want to take that, Alyssa, or I can take it?
I don't mind. So PTAs can not do an initial evaluation. We do, like with discussion with the PT, our PTAs do discharges. but again, it's just a collaborative effort on the like everyone's side. And I do think that varies state to state, I believe. I'm like, I know New Jersey, but I do believe that varies.
Yeah, so I would agree with Alyssa. Assistants can't do evaluations, and then in regards to discharge, it does vary by state. So some it has to be done by the PT. In other states, the PTA can maybe contribute to the discharge summary, and so there is some variation. Again, just kind of going back to that discharge or that practice act, dependent upon your state. So,
all right, thank you so much. Well, we have made it to the end of our episode, but before we log off, I do want to ask all of our guests if they want to add anything regarding the PTA collaboration, Ivy, our values, or just anything else they'd like to throw out there.
I'll just say, number one, if you have questions about the relationship, I think that Alyssa and Matt really presented a really positive relationship, but sometimes things don't go well, and we need to maneuver some of those. And so if you need advice, mentorship, even just the kind of vetting some ideas, I'm always here. And then also, I think transitioning from a PTA to a PT is a unique experience as well. So if you're a PTA and you're looking to become a PT, and you have questions, I'm always happy to answer any of those things and share my experiences. So again, I love mentoring and educating and providing support in any way that I can. And so reaching out, please do.
And I second Alyssa. If there are any questions around any type of opportunities here at Ivy, please don't hesitate to reach out to me. I'm also on LinkedIn. I'm happy to connect and have a conversation. I am also newer to Ivy. I've been with Ivy for about 8 months now. Time flies fast when you're having fun. But if there's any, questions around or, should I make the move or what does that look like? Happy to talk through any of those questions or concerns as well.
Yeah, I don't really have much else to add. I just want to appreciate you having us on here and giving us the opportunity to talk about this. If anybody listening has any particular questions, I know, Bismir, you're going to put our emails in the chat.
Yes.
Yeah, you can just feel free to email me. I'll be happy to talk to people.
Yeah, I don't really have much either. Same as Matt. Thank you for having us. And yeah, any questions, you can reach out to us.
Well, I want to thank all of you so much, Alyssa, Matthew, Becky, and Alyssa. You have been incredible guests, and thank you so much for sharing your stories. And I'm sure the audiences have enjoyed it as well. And please tune in for our next episode of Clinically Speaking. It will be posted on our LinkedIn, so if you don't follow us, be sure to tune in to our next one. And we hope you enjoyed this episode. Thank you, everybody.
Thank you.
Thank you.
Thanks, everyone.
Bye.